One. Hello, my name is Angela. We would like to share the output from the two integrated service delivery co-design workshops with you, which involved patients, service users and staff.
Hello, my name is Cara, and our focus was on developing a new integrated service model, including governance structures, and we all provided insights based on our lived experience. Why? So that as health regions develop integrated services, changes grow from needs of the people. We gave our feedback from what we shared with the health regions steering group, who were responsible for leading this work, including patient service user partners and representatives from the Department of Health. Christine.
Hello, my name is Christine. As partners, we wanted to share our lived experience so that our voices truly influence what happens as we develop integrated services together. A person-centered service needs to look for the who of the person. Who am I? See the person as a whole, not as a heart, a chronic condition, a home support package, but as a real person with a culture, strengths, vulnerabilities, interests, a life. What makes a person laugh? What triggers frustration? What makes them feel safe or unsafe? How difficult is the current situation for them? Is it a specific procedure or treatment, a chronic condition, an acute event? What about their mental health and well-being? What invites a person to or blocks them from engaging with you? A person brings their life, their health-related experience, as well as knowledge of themselves, their body and mind to the table. Healthcare staff bring themselves and their professional experience and knowledge. If we pool our experience and knowledge, speak with each other and hear each other, we increase the chance of growing a working relationship. Care, compassion, trust, and learning. What is the difference for a person when those values are evident or absent? We need staff who have the confidence to work with, who understand the importance of partnership, so that at the table together, we design and bring into being services which meet the needs of the people. How does the HSE board, the senior leadership team, the REOs message through their actions that their behaviours evidence partnership in practice, that they truly want this culture change to happen, that they support all staff to have the opportunity to learn that partnership is part of the solution? Genuine partnership needs mechanisms which invite and value feedback from patients and service users about what worked well and what did not. When patients, service users and staff share their experiences together, the opportunity for seeing more of the picture from different perspectives and for learning increases dramatically. Who is responsible for this culture shift to true partnership? All of us. Patients and service users, our HSE, the Department of Health. Partnership enables us to learn together. We all need to learn to work together. We are better together. Over to you, Donal.
Hello, I am Donal Conway, and I live with diabetes. Accessibility, in its broadest sense, was a repeated theme for many of us. An example of this was when I was admitted to my general hospital with a bad kidney infection. I had to wait for 2 days in a corridor on a trolley until a bed became available. These are the accessibility conditions that thousands of our patients must endure when a problem occurs with their health. This long-standing situation of access to a basic item in our hospitals, such as a bed, needs to be addressed by the HSE right across the country for everybody, and most of all, the most vulnerable members of our population, our elderly. We must have our dignity maintained. I met an 82-year-old lady I know who hurt her leg but would not use the A&E because she didn't trust what would happen to her. We must build trust in our health service system, one that is robust, transparent, and respected by all our people, and one that delivers a health service that values everybody's health. Also, there is an assumption that people can go to a service. What if a person can't leave their home alone? what do you need to build into the design so that these people are seen and have the resources they need to go to a service? What about people who cannot leave their home at all? How can we provide services at home, like blood tests, GP visits, sleep apnea assessments, ECG, physiotherapy? How do we support people with long-term illness conditions? Example, independence issues post-strokes. We must work together to lessen the administration burden on both the public that use the services and for our healthcare staff. For instance, requests for the same information over and over again. One of my fellow service users talked about medical card renewal and why have it when our daughter will not recover from a genetic illness. The forms are long, complicated, and not easily got. The criteria says you're not eligible for these services. It feels like a door slams in your face and you have no one to go to. Together, we must find ways to ease this burden for all of us. There are financial implications associated with ill health, and these create a huge barrier to accessing services. Do we yearn for our life to pass us by until we reach 70 to achieve a medical card? How can we consider the costs of the pressures of carers, childcare costs, family demands, and all the other pressures that can wear you down? My income should not stop me accessing and using services that will help me and support my recovery, whatever age I am. The other area raised in our workshops is access to certain specialist services. Those living with really complex needs need to know that our community services are able to provide the correct care at the right time, from the right service, and in the right place. So now I would like to hand over to Cara.
Thanks very much, Donal. So, after hearing what the others have said about challenges with social and financial barriers and accessibility, these are needs that have to be addressed with integrated care. What we need now is for everyone to work together, to listen, to hear each other, create supports for both parents, service users, families, and staff to make the experience seamless across the system. What we need to consider is, when designing a healthcare service together, that it is smooth, signposted, person-centred and safe. We want our experience from our homes to accessing community, mental health and specialist services, and acutes when needed, and back to our homes to be as smooth as possible. Remembering we need services for those who can't leave their homes, minimising service disruption by including those with lived experience in co-creating integrated services which are reliable and create possibilities for person-centred care. We want integrated care that is less hospitalised and more community-based. Reducing geographic variations, people should receive the same care and services regardless of where they live. When contracting with outside services, we need to make sure they have the capacity of delivery. The care coordination role is vital. Without it, we struggle to access and navigate the services that we need. We shared our lived experiences, and when it was working and when it wasn't, highlighting the significant impact this had on our physical and mental health. The HSE has a duty of care, and we experience the consequences and impact of inadequate services delivery. Integrated care must be designed to meet the needs of the people. Thank you.
Thanks, Cara. I'd like to thank all our partners who participated in the Integrated Service Delivery Co-Design workshops in July, along with all who have supported us in the Integrated Service Delivery Co-Design work. We appreciate the time and expertise that each partner has provided. These partnerships are invaluable in the co-design of the integrated service delivery model. And I hope that this summary of the outputs of the July workshops are helpful in informing the next stage of co-design. We'll close with some final comments from our patient and service user partners. Cara?
Thanks, Angela. Thank you for taking the time to listen to us. Christine?
It's always great to work with this team. Donal?
Thank you. I'm glad to be part of this excellent message.